This medication is used to treat Parkinson's disease and certain movement disorders caused by some drugs. It works by restoring the balance of certain natural substances in the brain. Different brands of this medication may have different uses, so it's important to follow your doctor's instructions and not change brands without their guidance. The recommended daily dosage and optimal timing for taking this medication will depend on your specific condition and should be discussed with your healthcare provider. When taking Amantadine Hcl Capsule, extended release 24 hours, it's important to follow your doctor's instructions. You can take this medication with or without food, usually once daily. Different brands may be taken at different times, either in the morning or at bedtime. Swallow the capsule whole and do not crush, chew, or split it, as this can increase the risk of side effects. If you have trouble swallowing the capsules, you can open them and sprinkle the contents on a small amount of soft food, like applesauce, and then swallow the mixture right away without chewing. The dosage of this medication is based on your medical condition and how you respond to treatment. It's important to take it regularly at the same time each day to get the most benefit from it. Do not stop taking Amantadine without consulting your doctor, as your condition may get worse if you suddenly stop or decrease your dose. Your doctor may gradually reduce your dose to lessen the chance of symptoms such as agitation, anxiety, hallucinations, depression, or trouble speaking. It may take several weeks for Amantadine to have an effect, so be sure to tell your doctor if your condition does not improve or if it gets worse. Some common side effects of Amantadine Hcl Capsule, extended release 24 hours include blurred vision, nausea, loss of appetite, drowsiness, dizziness, lightheadedness, headache, dry mouth, constipation, and trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist. Dizziness and lightheadedness can increase the risk of falling, so be careful when getting up from a sitting or lying position. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. If you are taking the extended-release tablets, you may notice an empty tablet shell in your stool. This is normal and harmless as your body has already absorbed the medication. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects such as unusual skin changes, swelling, vision changes, mental/mood changes, or muscle spasms, contact your doctor immediately. Seek medical help right away if you experience a seizure or a serious allergic reaction. Some people taking Amantadine have reported falling asleep suddenly during their daily activities. If you experience increased sleepiness or sudden daytime sleepiness, especially after drinking alcohol or taking other medications, inform your doctor immediately. Avoid driving or activities that require alertness. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Remember to contact your doctor for medical advice about side effects and to report any side effects to the appropriate regulatory agency in your country. Before taking Amantadine, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have glaucoma, kidney disease, mental/mood conditions, a certain skin disorder, sleep disorders, or a seizure disorder. Amantadine may cause dizziness, drowsiness, or blurred vision. It's important to be cautious when using alcohol or marijuana, as they can increase these effects. Avoid driving or using machinery until you know how this medication affects you. It's also important to limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially dizziness, lightheadedness, and mental/mood changes. This could increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, this drug can pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult with your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Amantadine may interfere with the effect of certain vaccines, such as the flu vaccine inhaled through the nose. However, you may still get a flu shot, flu vaccine given by injection, if recommended by your doctor. If you suspect an overdose and the person is experiencing severe symptoms such as passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. For residents of Canada, you can call a provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, severe drowsiness, shortness of breath, changes in the amount of urine, and mental or mood changes such as anxiety, aggression, confusion, or hallucinations. It may also result in seizures. It's important not to share this medication with others. This medication is prescribed specifically for you and should not be used by anyone else. Sharing medications can be dangerous and may cause harm to others. Always keep your medication stored in a safe and secure place to prevent accidental misuse. If you happen to forget a dose, just skip it and take the next one at your regular time. Don't take 2 doses to make up for the missed one. It's important to store Amantadine Hcl Capsule, extended release 24 hours at room temperature, away from light and moisture. Avoid storing it in the bathroom, and make sure to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.